Like and subscribe for daily OT brain boosters. An occupational therapist evaluates a client 2 days after a total shoulder replacement. The client reports pain and is wearing a sling per post-operative precautions. What should the occupational therapist do first? B. Educate the client on post-surgical precautions, sling management, and safe ADL techniques. Context: 2 days post-surgery, the priority is protection of the surgical joint and safety, with education and compensatory strategies before progressing to movement or strengthening. Early phase equals protect, educate, compensate, while later phase equals assess motion, progress, activity. An occupational therapist evaluates a client 2 days after a total shoulder replacement in an acute care setting. The client is wearing a sling and reports pain. Why would the occupational therapist prioritize education rather than testing shoulder range of motion during this evaluation? B. Removing the sling to assess full mobility risks dislocation, tissue stress, and increased pain, and violates post-surgical precautions. Context: in the acute post-operative phase, protecting the surgical joint is the priority, and education supports safety, healing, and adherence to precautions before movement is introduced. During the active assistive range of motion (ARM) phase following shoulder arthroplasty, for which type of shoulder replacement are pendulum exercises avoided? D. Reverse shoulder arthroplasty. Context: after a reverse shoulder arthroplasty, pendulum exercises are often avoided during the ARM phase because they may place excessive stress on the deltoid-dependent joint mechanics, increasing the risk of instability. Like, comment, and share. Learn something or nailed it? Follow us to stay OT sharp. You got this.